Hi, my name is Thiri. Thanks for coming to my interview. And this is for a class project on data aggregation and Burmese healthcare disparities in America. Um, so can you please introduce yourself?
Hey, nice to meet you. My name is Sherry Van. A- am based in San Francisco and I work in healthcare, but not at the hospital, at the business or commercial side. Um, and I'm actually heading to business school in the fall, so I'll be moving cross country to Cornell Johnson, but I'm here in the city for the summer.
Okay, that's great. Um, and just for background for the interview, Cherry immigrated from Burma. So can you please tell me about where you were born and what life was like there before you came to the US?
Yeah, so I was born in the former capital, Yangon, Burma, and I moved to the US when I was 6 years old, so I can only speak to like what I can remember from my childhood, but um, what I remember is we lived in a apartment right in the center of the city, right where like downtown is, and within that small, it was like a maybe two-bedroom apartment, and there was a attic or loft area upstairs that one of my cousins slept in. So in that apartment, I remember it was my cousin, my grandma, so my dad's mom, um, my mom, and I. So there was four of us in a two-bedroom apartment. Um, and overall, I think life was good. I think we like I had my cousin to entertain me whenever my mom was working or when my grandma was out shopping. I would like go to the market with her. Yeah.
Yeah, that sounds like a really um, close and tight-knit family that you're living with in the apartment. So what led you and your family to come to Burma? I mean, sorry, to leave Burma and come to America then?
Yes. So my dad has always wanted to come to the US. Even before I was born, he had a plan to move to the US because the situation in Burma wasn't great. For some context, the military junta uh, was in power, and there was no concept of democracy whatsoever. And he had his own business at the time and he wanted to immigrate to the US maybe in his like 30s or so. That's what he tells me. But then life happens. He gets married to my mom. I believe they were mid 30s when they got married, and then a few years later they had me, and that was when my dad really wanted to try to come to the US because he wanted to immigrate here for my education. He wanted me to go to college in America and have a better future. So he tried to come, but um, eventually, when I was so he came first in 2001 or 2000, and then he came first in 2000, and then 2002, 2 years later, my mom and I were able to come. And that was, we were coming under asylum because at the time, I think Hillary Clinton signed a bill to let some Burmese refugees immigrate to the US. So that's how we got to the US. And long story short, it was for a better future and my education that um, really motivated my dad to bring us to the US.
Yeah, that sounds really inspiring, both on your family part and also like listening in about your experience. Um, and So it must have been really hard to transition to America. So what kind of challenges did you face or you and your family face when you first arrived in the US?
Yeah, so my dad's English was okay because he did some business overseas, just locally in Asia, and he used to listen to the radio, the American radio. I don't know how he did it in Burma, but anyways, his English was really decent, I would say, for an immigrant. But my mom, however, on the other hand, she didn't know that much English at all. So, um, growing up, we were in this one, I would say, I don't want to say, but it was pretty crazy because um, me, my mom, and my dad lived in a one bedroom in a house full of other Burmese refugees and migrants. And the house was 2 stories. The owner was a Burmese lady who came to the US maybe in like the 70s. So she bought a house. And she housed recently immigrated Burmese people there. And I remember on the second story, so the first story, I think she had her own bedroom, and then my family was in one room, which was next to the kitchen. And then the second story was um, three Burmese guys. They were also recent immigrants, and they were in their 20s coming here to get their education and get a decent job, you know? Uh, and they each had their own like small little room upstairs. Life here. So the funny thing is, I also didn't know English when I came. So I was supposed to actually be in first grade, but I vividly remember taking an English speaking exam and they had asked me probably like, what's your name? And the only two words I knew at the time were yes and no. So I'm pretty sure I said yes to what's your name. And because of that, they were like, okay, she's not quite ready for first grade yet. Let's put her in kindergarten. So I went to kindergarten at Jose Ortega Elementary School. Um, and that was where like I, made friends, learned English. But I guess like to answer your question, initially immigrating to the US was quite difficult because of the language barrier that my mom and I faced.
Yeah, dealing with the language barrier is definitely very difficult, and you all have been so brave with like learning a new language and coming here. Um, and if it's okay with you, I'm going to transition into asking more questions about your experience with the American healthcare system. So I guess generally, what has your experience been with the US healthcare system?
Yeah, so I was lucky enough to be on my dad's insurance. So insurance wise, growing up I was on Kaiser. But I do want to point out that going back to when I had like first immigrated here, I had a I would say I had pretty mild to severe respiratory problems, and I would run around like kids do and be out of breath, for example. And so my dad, of course, like needed to like check me to do a full checkup physical exam on me. Also because I think the requirement for recent immigrants is a an exam before the kid enters any sort of school in the US. So we went to Kaiser actually to do the full exam, and I was cleared, but my dad didn't think I was like 100% healthy because I had respiratory issues. So coincidentally, he saw a sign at the public library, the Excelsior District Public Library that was close to our home. So the sign was like free clinic, and so we went, and he made me see the free clinic nurse that was stationed at the library. Like I think it was on a weekend. And according to him, she had like experience in like the developing. She was not from here. She was also an immigrant, and she had experience sort of seeing kids like me. So actually, she was able to give me a diagnosis that I had tuberculosis. And that explained where my respiratory issues stemmed from, as well as I was very underweight. I think all kids are skinny, but I was super skinny. Um, but luckily, it was the doormat kind, not the super infectious kind where I couldn't attend school. So she gave me that diagnosis, and I believe she gave me 2 years of oral medication to take in order to um, uh, for the treatment. And I did take oral medication for 2 years, and that was it made me feel better.
That's great. I'm really happy that you were able to get the TB diagnosed, and I'm happy that you're able to go to a more culturally competent provider, despite running all the tests at Kaiser. And that leads me to my other question. Do you think, just in your experience or like the experiences that you've had with your family or in the Burmese community wider, do you think that doctors or healthcare providers understood your background or specific needs as a Burmese refugee?
Um, I would say no to uh Burmese part and also to the refugee part. Growing up, I always got, oh, where's Burma on the map? Or is it the country Myanmar? It's not called, it's pronounced Myanmar. Um, so no one really knew where I came from or really, I mean, I look ethnically Chinese, so everyone assumed I was East Asian of some sort, or sometimes I also got Vietnamese because of my last name. So I think the doctors were, I was probably, hmm, my family and I were probably the first Burmese refugees they ever treated, or maybe the first, like they could probably count in on 10 hands how many refugees from Southeast Asia, because I know that Southeast Asian community is a lot smaller as well, that they had ever treated. So I would say that they had a limited understanding of who I was and where, like, what kind of situation or background that I came from.
And just as a follow-up question, like, do you think that understanding this background is important? Like, do you feel that it's important to you? Do you feel like it's important to others? If you can speak on that.
Yes, I think it's important, especially in the healthcare setting, to be aware of cultural nuances and to deliver personalized care. Um, I say that statement as someone who works in the medical device industry, and my job is conducting market research surveys to healthcare providers and patients and taking all those insights back to the company. I have found that um, like if you go to a PCP, they don't really have time to see all their patients, let alone be mindful all the time of like maybe the specific cultural nuance or um, background that their new patient is coming from because they are so bogged down by paperwork, for example, and they just have a lot on, they just have a lot of patients to see in any given day. So I don't fault them from it. I see it from the healthcare provider perspective too, that the workflow is quite heavy and there is a paperwork burden as well as just the shortage of staff. But from the patient perspective, so I work for Abbott Laboratories for diabetes care. So the patients I interview are people living with diabetes. And sometimes diabetes can be a sensitive topic, and there is definitely some social stigma around it, around diet and exercise, and sort of advising the patient to modify their behavior for a better, healthier lifestyle. But then that's like the clinical side of it, right? You want someone to change their behavior, but then like the way that can be delivered to the patient can seem not as constructive. So I've interviewed patients such as myself like that. Um, sort of been discouraged after seeing the doctor from even changing their status quo behavior because they felt so ashamed and they won't even see the doctor because they feel ashamed that they couldn't stay on this regimen or diet that was prescribed to them, or treatment that was prescribed to them. So there's some like gap the in the like patient perspective and unmet need of like what they want from a PCP or a specialist to tell them to get treatment. Yeah. And then, of course, like if you layer in the cultural nuances of being a refugee from a country that they've likely never heard of, or maybe they have, but they don't know anything about other than maybe a tea leaf salad from Burma Superstar. So it's like an onion, right? Like there's the patient, and then there's like social stigma, situational stigma, and then there's cultural layer that you also have to consider, and maybe like the status of like their immigration as well. So definitely a loaded topic there. Yeah.
Yeah, thank you for talking about like social implications. And I think it's also interesting because you work and have a like a data science background and that you're dealing with, healthcare data all the time. Um, and so as a follow-up to that, and because you have such a unique perspective, I was wondering, do you like do you think that after looking at the data that you think that Asians should be lumped together as a category? Do you feel like there should be a need for an Asian and a Southeast Asian, or do you think it should get more specific? And like why or why not? And any opinions are welcome.
Yeah, so I'm a market researcher, so I may be biased to the fact that all data should not be biased and that the sample is representative of the population. And if we are to get into statistics, just from a statistical perspective, the Bay Area's population is not just of Asian people is not just East Asian, but also Southeast Asian, just because we are so culturally diverse. And there's different racial groups, and of course, like within that subsets. So we definitely need to consider the fact that East Asian and Southeast Asians are different, geographically and culturally, and their life stories and perspectives, of course, will not be the same. And so I do think that there is a need to delve deeper and recognize that there are subcategories to each racial group. And within that, like there may be Southeast Asian who grew up in the US and those who are immigrants or children of immigrants, right? Like what generation are they? And that may have some implications to their experience with the American healthcare system.
Yeah, you're right. Like the Bay Area is so diverse. And I guess following up on that, I want to know more about how you feel like when you see a form that says like Asian and or sometimes even Southeast Asian. Do you feel comfortable checking the box, or do you feel like it doesn't reflect your experience, or do you feel like it totally is okay and reflects your identity?
Whenever I see those boxes, it's a little bit interesting because it would be white, black, Asian, uh, Latinx, indigenous. And those are very disparate categories of races. I mean, I'm just naming the few, right? And so I would feel like, yeah, like Asian is the closest category that I would resonate with. And so I do check that box, but um, it would be nice to have a another box where it's like, okay, Asian, but then a drop down of like, are you East Asian, Southeast Asian, South Asian? Just because like population wise, China and India are quite large. And if we're like talking like just about population density and numbers, they are very different from Burma or even Vietnam or Thailand.
Yeah, that makes sense. And I also feel the same way as someone who is also Burmese. Um, um, I guess that's a follow-up question. You did mention it earlier, like you touched on like being representative of the population. You also touched on making sure that, some groups aren't overpowering, like the Asian category, just like based on population numbers. But it's also okay if you don't want to add on to this, but personally, like, why do you think it matters whether Burmese or other refugees are counted separately or with their own category in health data?
I think um, beyond the fact that we are culturally different, it's probably I guess, for lack of better words, it would be like newness or sort of like recency of immigration to the US. I think that if you're talking about it from a historical perspective, East Asians have immigrated to the US much long, like since, for example, my background's the Golden Gate Bridge, so since the gold rush. Um, and so they have a better maybe foothold and they have sort of established themselves as a racial group living in the US. However, I think Southeast Asians um, have only recently been allowed to immigrate to the US for um, very adverse reasons, like the Cambodian genocide, for example, the Vietnamese War. Um, and so maybe the other factor to consider besides recency of immigration to the US is the reason of why someone would immigrate. A lot of the times, I think that Southeast Asians come to the US this is just from my perspective, not by choice, but because they have economic um, or political, socioeconomic reasons to seek a better life that is different from like what they have at home. And so I think that sort of like rationale for why you're in the US, and of course, like being a new immigrant, you would want to seek some sort of commonality or community. And if there are maybe five or seven Cambodians that you know or Burmese people that you know versus like 50 or 70 Indian like Indian Americans or Chinese Americans that you know, that can like of course play a role in feeling like you have the resources to integrate properly to life in America. So from a resource perspective, just by like sheer numbers, there's a difference there. I think according to the US Census, Burmese people are 0.02%. Correct me if I'm wrong. I looked that statistic up when I was curious in undergrad at Berkeley. So yeah, so like not even 1% of the US population, right? So if you don't have enough people, like if you don't have enough representation, how would you have enough resources? Yeah.
Right. Yeah. Like, you know, how, how can social services like help people if like we don't know who to help? And I think part of that is, I could be wrong too, but I feel like that number is severely undercounted. Just because like if there isn't a category, if you're just gonna lump Asians together, then like there wouldn't be a counting of Burmese people. And on top of that, I also think like what you said, like also in our experiences, like Southeast Asians come to America just for like educational, and also because of like everything bad that's usually happening in their home country, and they're like less likely to have, also like economic power in the US as recent immigrants compared to like third generation, fourth generation immigrants. And so, like as we know with COVID, like money is also a social determinant for health. Um, but so thank you for your really thoughtful answer. Um, I guess one of my last questions are there any health issues that you think are more common in the Burmese community here but aren't being addressed? Like whether that's mental, physical, I don't know, any type of health, I guess.
Um, from a professional perspective, the top one is one of the top three like diseases that any Americans would face. It would be diabetes. Um, a lot of our Southeast Asian diet is, I would say, just quite unhealthy with like the amount of sugar. And I think that healthy habits and healthy eating is not necessarily a concern or even widely talked about in our Southeast Asian communities as we're so as immigrants, like we're so focused on finding a job and making it in America that we neglect our health. So physical health wise, it would be diabetes and maybe like along with that like hypertension. So not being as mindful of our diet could lead to that. But mental health wise, it's definitely um overlooked or even not even considered a topic of mental health if a family like mine is so um, focused on making enough money in their multiple minimum wage jobs to pay the rent, they obviously don't have the time or the money to go and talk to a therapist about whatever it is that they need to unpack. And I think that intergenerational immigration trauma does exist and needs to sort of be talked about more openly, but also what can we do to get to the root of the problem, which is um, besides mental health and physical health, like are the basic needs of recent immigrants being met? And if not, then how can we bridge that gap?
Yeah, that makes sense. And I think like you articulated a really nuanced and like perfect and a well thought out answer, like just considering the different implications of health. Um, and so my last question for today is how do you think that healthcare or maybe government services could be improved for future Burmese refugees?
Hmm. I think if I had a wish list, it would be sort of in chronological order. So chronological order to um, before they immigrate to the US. Can they gather, for example, like I had a lot of cavities when I first immigrated to the US. I pulled out 6 to 7 teeth in one sitting, baby teeth. But it was so bad my dad had to carry me home that day because I was crying. But when the sort of the first few times I visited the dentist, for example, they asked me about like my prior medical history and had none of that, obviously. Same thing for PCPs, like I had none of that. Um, so it would start actually, so like my wish list for like resources for um, Southeast Asian immigrants or even just immigrants from other parts of the world would be maybe like threefold in chronological order. So like before you immigrate, can they gather like medical history or records or any sort of exams or sort of like note that they're moving to a different country where treatment or checkups or exams may be delayed, or they may require some additional context for like the best treatment outcome possible, right? So like some sort of a checklist maybe that maybe like a training video or just a simple like list in the language that they prefer. Like, okay, these are the things that you need to get ready. And then while the first maybe 30, 60, 90 days that they are here in the US, some sort of like initial like um I wouldn't say like I mean it's so hard to find a PCP, but I would like absolutely want an interpreter to be there at their first exam with the PCP. Just because first it's like, like you're navigating a new country, a new language. So you would want someone, a familiar face or a familiar person who can uh conversate in your language to be there to bridge that gap and to make them comfortable in disclosing health information because again, there is that social stigma of like not wanting to um, disclose something for whatever reason that the patient does not feel comfortable telling the doctor at that time. So an interpreter for them in like the first couple exams maybe, and then I would probably desire some sort of like follow up again with the interpreter to have like success in the treatment or whatever health outcomes that they're seeking to accomplish.
Yeah, thank you for laying out a well thought out threefold plan. Maybe you can maybe you can help out with that somehow. But before we end our interview, do you have any questions for me?
Um, as a first, or I would say, I think you're 1.5 gen because you're a child of immigrants, but you're born in the US. Um, Sort of like, what is your perspective on growing up as a 1.5 gen child in the household in terms of like what we discussed today for like healthcare.
Yeah, I mean, I think that especially as a 1.5 gen and someone that's like domestic born, I'm definitely very privileged compared to everyone else. Like compared to everyone else who is immigrating from Burma now, was or going to immigrate in the future and is like, someone my age. I mean, I remember when I was younger and I was thinking to myself, like, wow, I haven't really met anyone who is Burmese. And everyone I do is quote unquote really Burmese. And like that's because they were, foreign born. And that's just because like I think that the Burmese American identity for like 1.5 gens hasn't really been established yet. But I think in terms of just health, like I would say I feel like a bit of it has made me more interested in a specific career path, or talking about like uplifting Southeast Asians and specifically Burmese people just because of like the privilege that I have, and um, I think that it just made me more interested in like being a health provider or like a Burmese health provider because I understand and like see all these things and like I see this from an American perspective because unlike the immigrants who come here and are, rightfully very grateful for all the services, like I have the privilege to critique and that's what I'm going to do all day long. So, and that's because I can critique, right? And so that's just my short perspective, but thank you for the question. Um, yeah. Anyways, well, thank you so much for being a part of my interview. If you have any questions, you can always reach out to me by email, and I will let you go for the day. Thank you.
Thank you. Bye.